Hello, everyone. So today we have another podcast of Bumps and Blooms. Pregnancy is full of advice, checklists, and then reassurances. But how often do we truly understand where a woman is standing and her perspective and where she's coming from? So in this episode of Bumps and Blooms, we're gonna explore what happens when there's discomfort, when there's pain, and sometimes the intuition is dismissed. So sometimes it's unintentionally, and how listening can transform the pregnancy experience. So we are together today with Juliette Dutoit, and then our space holder, Caridad.
Right.
And we're going to explore the topic of when there's injuries, and some moms sometimes, not always because they want to, but they ignore these cues that their body gives. We're going to talk a little bit about that, and then from your perspective, and then from a doula's perspective, how we can assist mommies in this situation.
Yeah.
So to start off with, Julie, tell me a little bit about yourself. Tell me about your training. Where did you do your training?
So I trained back in France and then I trained in the UK. So I did the University College of Osteopathy and then I went on to do 2 years of masters in women's health. So most of my studies all happened in the UK, but then I went off to work in Melbourne and in Hong Kong before coming into the UAE. So very excited to be here now.
Yeah. Well, thank you very much for being here. One thing that I've been following you for a while, and one thing that I really is, excited about having you here is that you have this innate, how can I say, passion about helping women. Not only you do yoga, you have these pregnancy yoga classes. Am I correct?
Yes, so I do. I come from a sporting background. I've done ballet and ballroom all my life. So I've been very grateful that throughout my ballet and throughout these stages of my life, I had physios and osteopath. I had a huge amount of training in pelvic floor, whether it's obviously learning about the pelvic floor and then obviously deciding to grow the passion into women's health. I'm also very passionate about pediatrics, and hence why I ended up following and pursuing after ballet through a more kind of holistic and yet very physical based profession to help. So I'm a yoga prenatal instructor, which I don't do in Dubai currently. I did in Hong Kong, but in Dubai I do give Pilates sessions, whether it's pre or postnatal or just simply someone that needs a bit of help, men, female, whatever.
Is it very different if you do normal Pilates versus if you're pregnant?
Yeah, so when we talk about Pilates nowadays, Pilates it's starting to become famous, but let's bear this in mind. Pilates has always been there. It's created by Joseph Pilates back in New York. So it's always been there. People just really started recently to know about what is Pilates, what's mat Pilates, what's reformer Pilates, what's cardiac Pilates, what's chair Pilates. We can't, do Pilates the same way for a pre and postnatal. There's different variabilities, there's some consideration. We don't have the same person in front of us. They're going through different phases of their lives. So we need to take that into account. And then also take into account that Pilates is also very used in clinical basis to rehabilitate. So after an injury or anything specific from an ACL recovery to a fracture, etc., etc. So it's used in multiple different areas, and the way we use it has to be adaptable to the person we have in front of us.
It used to be more for sport, am I correct?
Initially, it was for sport.
Yeah.
Big ballet dancers and gymnasts. Joseph Pilates used to train ballet dancers and gymnasts at the beginning, and then it got implemented in the hospitals back in the US. Now it's become a worldwide, very famous industry where everybody wants to do it and want to have the benefit of Pilates, which I find that absolutely remarkable.
Yeah.
I think he would be very proud of himself right now.
And how does that relate to pregnancy? How is it different?
I think a lot of people misunderstand Pilates. They think Pilates is stretching. Pilates is not stretching. It's a workout, a focused workout. It utilizes what we call the deep stabilizer muscles.
Yeah.
So it's a different set of muscle than, when you're out in the gym weightlifting. It demands a lot of coordination with your breath. It demands a lot of body awareness and core focus understanding. A lot of people has never heard about pelvic floor muscles before, whether it's men, female or man. Man also have a pelvic floor, just to make it clear. Yeah. And hence why now we're having a lot more men in the industry nowadays. But so it's really it's this practice that can be, people like underestimate the benefit of it, and until they don't actually understand it or actually do something, they're not quite sure how it can relate to them. I have loads of patients they've never done Pilates, and they do one session with me and they were like, whoa, I had no clue I had these muscles before. So it's quite fascinating. So you have to use it accordingly, but it's a great way to learn different things about yourself.
And to break that stigma that pregnant women shouldn't move or do exercise or work out or focus on their body.
Yeah, a lot of fear around that. But we're sure
you get pregnant at your 60 in bed, don't move.
Don't do anything, don't work your core. Obviously, there's different things we can do, but I'm sure we'll talk about it a little bit more further.
So how many times have you found that a woman comes to you saying that I'm in pain and it was ignored for a long time by medical professionals? Does that happen?
I think that the main important thing is to understand the difference between being listened to versus reassured.
Okay.
Reassured is basically, you're not dying. This is just pregnancy. And it's kind of like, I put it in kind of a sense where it's like a conversation stopper. That's just pregnancy. That's just complication of pregnancy. And that's very different, that reassurance. It's basically silencing the patient's distress in a way, instead of really being listened to. I can tell when a patient sits into my clinical room and I know the difference between, they're not looking for a reassurance, they're just looking to tell their story and to be listened to. And even if at the end I'm going to reassure them, because you kind of have to demystify what they've been saying, and then kind of go back to what's, obviously the myths and the facts and the different things. But at the end of the day, there's a huge difference for me between saying, this is just pregnancy, then instead of actually sitting there and not saying anything and just listening. And that's where I think reassured versus listened to are completely two different things.
But I think also it's because who are they going to ask the question to? Are they going to an obstetrics and a gynecology? It's not their speciality. They don't understand it. So the response shouldn't be, it's just pregnancy. The response would probably be, that's not my domain. I'm not sure. I don't understand. Maybe you should look out. Maybe you should find another person in the community that can assist you better than I can. And I think the ego sometimes doesn't allow that to happen.
It's a conversation.
It's a conversation. Exactly.
It's a conversation.
I have no idea, but instead of saying I have no idea, they say, oh, it's probably just pregnancy.
Yeah.
And it just kind of like softens the blow of saying I have no idea. So I think that's where what's been happening.
And I think also, we're all in different. You have to kind of put a stop to your scope of practice. You can't do everything.
Yeah.
I'm not this, and this. I'm an osteopath. I have my scope of practice. OBGYNs, they're very busy people. They don't necessarily want to hear about your pelvic girdle pain, even though it affects 45% of the pregnant ladies. Same thing with urinary incontinence. Last time I had a patient walking in and she said to me, told her OBGYN she was leaking while she sneezed, which it's kind of, we call it stress urinary incontinence. And the OBGYN said, that's just a complication of pregnancy. And I think when she came to me, I kind of looked at her and I was like, she looked at me, can you help me? And I feel like sometimes, instead of saying that, definitely I feel like some practitioners could reframe it in a different way. And I think instead of creating that fear or that way of saying you're very high maintenance, you're bothering me right now. And I think it's always comes to how you're phrasing things. And that for me is important to make a difference.
Yeah.
It's the way we could, as practitioner, myself and other people can phrase things. I think that will remove a lot of the anxiety and fear, and then the normal versus common.
On that note, that's why we're so valuable.
I agree.
We're that bridge between this information and the lack thereof. And we're like, you know who you should see? You should probably go see Juliette.
Yeah.
The OB-GYN cannot help you because limitations. But these are your resources in the community, and these are the people that you can find to answer these questions for you.
Yeah.
Properly.
Yeah.
Exactly. I feel like we as healthcare practitioners needs to work more together and also listen more to the patient. I do truly believe that sometimes, there's a lot more to somebody's life and environment, but we can take everything.
There's a whole being.
There's a whole being, so we can help.
That's also why we have these talks, because it's also about, everybody being empowered. The mom being pregnant, sitting there, having the power to understand what is her options and what is available.
Yeah.
Because, 10 years back, well, now 20 years back, 22 years back, I didn't know that these things were available. You only had a couple of resources.
Yeah.
And one of them was your doctor or your gynecologist. We didn't had all these things. And even if you had them, when you're pregnant, you don't think, I might need an osteopath, right? So, and you're right, Caridad, a doula can be that person who can empower the pregnant mommy and to direct her in different directions, because it is all about community.
Yeah, 100%. And I think also it's important I know sometimes I can't help because it's much more of a, let's say, a mental health issue where, you're going to need 2 different scope of practices to actually be able to help. And I think, laying back your ego a little bit sometimes and trying to open up different doors can be a lot more suitable for that particular patient at that time, and then through their working. But it doesn't always happen. But hopefully we're all working towards this.
What would you say is a pregnancy-related issue that you see that actually surprises you, that you didn't know before you did what you do today, that women experience?
I think there's loads of it. I mean, the common things that the mum will tell me is like, Juliette, nobody told me about vomiting and nausea. I was like, what do you mean? And she's like, all my friends vomited and has nausea. Like, is that going to happen to me? It does account for approximately 3/4 of the women would experience nausea with or without vomiting. And then 25% won't experience that at all. So you've had women, they never heard about nausea or vomiting during their pregnancy. And then you have the extreme hyperemesis where people would be severely vomiting and nauseous, and that will, cause a lot of weight loss, and it would cause a lot of dehydration, etc. So you've got really the extreme. You've got the woman that will never experience that, and then some woman the complete opposite, and hence that can really create some fear in some women. And some of them would be very shocked by it because they've never heard of such thing. So I think that's a big one, the morning sickness. And they're called morning sickness, but they actually can happen at any moment of the day. It just gets you. I've never been pregnant, but from the description from my clients, it gets me here, etc. So I feel like that's one of the big ones. And then obviously, they would describe a lot of symptoms like, for example, rib pain is a big one. So nothing related with the abdominal wall, but rib pain, pain in the thumb, a lot of like reflux, a lot of burning sensation that can caught up off guard. You have to imagine pregnancy affects all 7 systems of our body: cardiovascular, respiratory, musculoskeletal. So what's amazing is that the woman is hugely adaptable to that period, but it's also bearing in mind that every single system in our body will be affected differently depending on the trimester. And that will affect your breathing pattern. shortness of breath, the mum was like, I can't take a deep breath anymore. And it really, they don't, a lot of them, especially if that's their first time, will come with, what is happening?
Yeah.
Why is this happening? And that's where, quantifying what's normal and what's common is also very important. So what's, common affects a lot of people, and what's normal, which is like biologically optimal, is very different. So that's where I think it's very important to discuss that, explain what it is. I think I have pelvic girdle pain. Pelvic girdle pain is an umbrella term. It's not just pain in the front. It's the whole pelvic girdle. Is this normal? Well, being in constant discomfort, no, it's not normal.
Yeah.
Being in that high state of alert, no, it's clearly not normal, whether it's pregnancy or not. So that's a big one, and and a lot of patients will come in being absolutely baffled by the symptoms, and nobody's there to help them. And we actually know that there's been a lot of research that untreated pain during pregnancy will cause a huge higher risk of anxiety and depression. So it's very important. It's not because we don't see something that it's not there, and we always have to bear that, at the back of our mind. Sometimes I've seen in clinic, they come and they tell me, I've got pain here, and you examine everything, and you can't really find an accurate explanation to why this is happening, but it doesn't mean the woman is not experiencing it. So always be very, to listen to the patient, acknowledge it, not ignore it, and then work through it with them. Because we do want, at the end of the day, they do need to go to labour, and they do need to deliver in the most optimal conditions.
It's very interesting because I never thought about it. If you think about if there is pain, of course there's inflammation associated with it. There's higher levels of cortisol associated with it.
Yeah.
And that will all affect mom and baby.
We've talked about it.
So-
Epigenetics, the tension in the body. It's
Yeah.
going to cause problems everywhere.
Yeah.
And I always tell people pain is a gift. It's a message from your body letting you know that
Yeah.
you need to do something.
Yeah.
What is that? Now we need to discover what is it that you need to do so that you can relieve that pain. Because
Yeah.
it's clear, it's a gift. And what the doctors are really good at are masking the pain. Here, take the drugs to mask the pain, and now you've eliminated where's the problem coming from. What's the core of the problem?
I think a lot of the women would say pain is like a sort of failure, when it's actually not failure. It's the body telling you need to do something differently to help you. And then the stakes are even higher when you're pregnant. So people get worried.
And I think as women folk are very good at ignoring
Yeah.
sickness.
We're good at sucking it up.
Yes.
Yeah.
Keep it going.
Yeah. I feel like a lot of women would tend to isolate themselves because, again, with us, we want them to be, how do I say, good patient, low maintenance.
Keep
So,
society running.
keep
without-
society running. You just have to deal with
Be
it.
in service.
Yes.
And I've talked about this recently at a mom's morning.
Yeah.
They're like, I feel selfish if I take 2 hours for myself.
Yes.
I'm like, let's discuss the word selfish.
Yeah.
It comes from a place of society teaching you that you have to be selfless.
Yeah.
To be a good woman, to be, a good part of society. Let's eliminate selfless, and now we're no longer selfish.
Yes.
Right? So it's the conditioning, the programming for sure.
Yeah, it's a whole program. And at the end of the day, the reality is that a pregnant, the privilege of being pregnant, the body is going to have to pay for it in some way.
Yeah.
So, it's kind of reframing all of this and demystifying the myths and the facts, and being able to help the individual, to be tailored to them and not to everyone. Because a lot of, nowadays with applications, social media, this and that, I feel like the women just completely lose their self and their confidence in themselves because they are in the medicalized system, and then there's their application telling them what it is, what stage this, and then social media that this, and that.
So over information.
Overwhelmed by the amount of information and sometimes the miscommunication that can happen. I still have today, I know I wanted to point this out today because it happened again yesterday, a patient saying to me that was postpartum, I didn't realize that I could have a period when I'm breastfeeding and then I can be pregnant while I'm breastfeeding. And I said to her, where did you hear that? And it came from somebody else, but obviously translated it to somebody else. And it baffled her. And she was almost crying because she had no clue, because she had her period. So she was shocked. And, you're in the 21st century, and sometimes I found it very frustrating and sad that correct information is still not out there and being pushed out there. So I feel like we have a lot of work to do.
Yeah, no, I agree. And one thing that I've realized, the more educated women are, right? It's almost like they give themselves over to education, to, doing a job well, just running. And I think society, and 50 years ago, 100 years ago, was a lot more supportive of women giving birth, teaching our daughters what is going to happen, supporting them through the process. And this is not happening anymore.
No.
And so sometimes you sit with a woman that's extremely educated, and then the smallest thing just throws her off.
Yeah.
Because it wasn't shared with her.
Yeah.
There was no mom, no aunt, no sister who would actually help her and get her through this. Because we isolated, I think, I don't know about you, Caridad. How did you?
Yeah.
Yes.
Thanks. Thanks a lot. She just read my book. She knows quite well my history. No, so it's one of my personal missions. I come from a place where my mom left, and the mother wound and not having access to women or community or anybody to protect you or to give you information. See, you suck at the. You see what she did? But I've officially incorporated yesterday this new passion project, which is basically just publishing all this information. I'm working on a book for teenage girls and explaining to them the magic of their bodies and the periods and the menstruation and the cycles and what happens when you do get pregnant. Because it is a lot of lack of information and proper information that comes from wisdom, but also comes from evidence-based information.
Yeah.
And we have the free birthers on one side, right? Like hands off, leave me alone. And then you have the over-medicalized. So where do we find the balance? So that is a personal mission because it is important to start from when they're little.
Yeah.
Like my daughter used to see me sit in women's circles all the time. And we used to have a conversation. If somebody was in pain, we would say, hey, you can go see so-and-so, or maybe you should get checked out. And giving them just permission to go out there and take care of themselves.
Yeah.
And my daughter used to see this and she's like, when can I join? I'm like, when you get your period, it's such a gift. You become part of the society.
Yeah.
And I gave her something to look forward to instead of like, oh my God, I'm so shameful.
Yeah.
And just having moments like that and treating society that way, I think just giving us permission to be honest. Everybody laughs at me because I'm always so honest. There's no filter.
Yeah.
No filter. I'm like, there's no time for filtering.
Yeah.
You have to be honest. Something hurts, something hurts.
Yeah.
I'm peeing myself, guys.
Yeah.
Oh my God, that's not normal. Maybe you should go see Juliette because if there's somebody can help you.
Yeah.
Somebody can help you. If she can't help you, she'll guide you to somebody else that can.
Yeah. I think
I
think all of this really stems also from, like you mentioned, childhood, where I think as we grow up, I know, for example, when I used to be in ballet class and we were only girls at the time, maybe even one men, you had to hold it in. Whether you were in pain, your bladder was painful, you had to hold it in and wait. And we were always, for me, as a child, you were already, self-doubting your body and, you didn't quite know what was happening, but there was a lot of things that made you feel like that way because it was like, well, you're a woman, so you can't pee out a tree. You're going to have to hold it in and wait for the end of the thing. My period's painful. Well, that's how it is. I have teenager complaining of painful period. it's part of the game. It's PMS. It's this. It's that. So I think it starts so early on, then through generation and through time, it just gets ingrained in your, in your family, and then the family passes on that to you, and then it just becomes
almost shameful to discuss it.
Yeah, exactly.
And then you can say, it's not shameful, let's talk about it.
Yes.
Yeah.
How's your bladder now?
Yeah, it's better, yeah.
What we need to know.
Yeah, I do. I definitely do. And even sometimes, like, I don't have time, but I still go. And I sit down and I take my time.
Even before we start.
At school, there was no, like, you couldn't, even at school, raising your arm up to go to the bathroom. It was like, what do you need? Bathroom, you can wait 5 minutes. Oh, well, not really. I need to stand up. I need to go. So, yeah, I think there's a lot of things that we can do at a younger age to, don't feel ashamed and not fearful, and, make it a little bit better for the future generations to sort of grow in a more safer, less fearful environment. So
does this relate to where women learn not to trust their bodies?
Yeah.
And then when they're older, they have issues and we ignore then maybe the pain or the discomfort that we
We're
experience.
taught issues are normal.
Yeah.
We're all going to have issues.
Yeah.
I always get, what time of the month are you on right now? Because what you're saying doesn't work for me right now. It's always like we're blamed for being weird, and we should suck it up.
Yeah.
And be quiet about it.
I feel like it has a huge impact on women's body image. And, some patient has I have a lot of cases where they have never had to look at what's going on down there. Or,
I'm always like, take a picture. And they're like, what are you talking about?
Yeah. They're like,
why would I do that?
Yeah.
Because you're complaining of something, you want to see what it is.
Yeah.
Like, if you've never seen it, how are you going to know there's something happening?
big stigma, big taboo, big everything. And that's it. It doesn't help to then lead to being pregnant, and then evolving through it, and then when you're pregnant, you're growing a human, but you're also growing a mother, and all of this has consequences on how people might feel about certain things, and obviously pelvic floor issues, but pain, discomfort, etc., etc. So there's definitely more work to do around that. So there's the physical pain, but there's also, let's not forget, the sleep. Even when you're pregnant, people forget about that. The sensory input are very different, and heightened smells, they get shocked by that. And also everything that's related to mental health. So perinatal anxiety and depression, fear around, that first trimester, miscarriage, big one. I think that's not even talked about the slightest, that critical period where I think a lot of women at the back of their mind, whether they've experienced a miscarriage or not, will always have it at the back of their mind. And the part of the issue with miscarriage is that we don't have data, so there's no status. It's highly misunderstood. It's highly under-researched, but it affects a lot of people. So I feel
we're
like
just starting to tell people that your husband may have something to do with that as well.
Exactly.
What?
Exactly.
Your partner has something to do with that.
So all of that intertwines everything. And it can be also, pregnancy, despite the physical pain. I see a lot of pregnant ladies that can feel extremely lonely, extremely doubtful and fearful because of different environment, but also the support system, whether it's their side or our side as healthcare practitioners. Let's not forget about the cost, also financial background. So all of that will have an impact in terms of, the patient coming in being like, nobody told me about this. So
can I ask you a question that I hear sometimes, because I'm a community person, so I hear it numbers. So does an osteopath, do you guys use like magic, energy? Is it real science? Is it medical stuff? What's it based on? Like, just in the simplest terms, is it magic? Is it woo?
No, I mean,
clearly I'm magic and woo. I've owned it. But
I mean, osteopathy it's created by Dr. Andrew Taylor Steele back in the US, and he actually created that movement of osteopathy because he couldn't sell his daughters for at the time what happened in the US, and so he wanted to, how can I, instead of making my daughters bleed and get rid of the fever at the time, what else can I do to kind of restore the homeostasis and balance of our bodies? So depending on where definitely nowadays you've graduated from, which country you've been taught osteopathy, we use different techniques. So you've got craniosacral therapy, you've got visceral osteopathic manipulation, then you've got the more HVT, which high velocity manual thrusting. You've got loads of different techniques in osteopathy. Now, when it comes to women's health, and then women's health, you don't really necessarily train in it. Same thing with physiotherapy. It's not really. It's a little bit part of the curriculum, but you do need to go and do some extra training to really specialize in that field. I did 2 years in total, and you keep constantly updating. And when it comes to that, you do have to, the osteopath that I know and their women's health specialists, they do come from a very evidence background. We're not just doing magic to the pelvic floor.
You're not just putting your hands
no,
the Reiki.
Exactly. We're not quite doing that. And
we're using the sound bowls.
Yeah, and I mean, you can,
it's
and
magic.
I know osteopaths that do that. I know also physiotherapists that do.
But it's part of more.
Exactly, it's part of more. When we're just talking about obviously like helping pregnancy and everything, like obviously you kind of have to have some sort of evidence base, and and nowadays
specifically because I've seen deliveries. I mean, I've seen hundreds of babies being born, and I love my work. But sometimes I'm like, that was a tough journey for this baby.
Yeah.
I think you should see an osteopath in the next week.
Yeah, to help them.
And then, but my pediatrician said, no, baby's clinically fine. I'm like, okay, but there's more to it.
Yeah. There's a bit more to just the science. There's a lot of things that we can, when we see the baby, the body, the tension, how they were delivered, C-section, vaginal delivery, all of this. Definitely we use these techniques to really help through there. And then obviously educate the parents as much as possible through that. And you need to educate about the pelvic floor in a way where it's accurate also, and make them comprehend the message that we're trying to pass through. So I feel it depends. But for me, personally speaking, as an osteopath, I have for me, the power of knowledge and educating is very important. The osteopathy manual therapy side of thing is one thing. And then obviously everything that's kind of rehabilitation, movement, physical activity is something else. And I feel like if you can bring all of this together, I think it's not a bad thing.
So it is magic.
Sort of. Yeah. Almost. Sometimes there's some
magic involved.
Yeah. And sometimes
I think giving people power and knowledge and information and letting them tap into their intuition, it's all magic.
Yeah.
And that's really the goal that everybody has at the core, I think.
Yeah. And there's things you can't explain, and there's things, science can't explain either. So yeah. I feel I've learned more in clinic compared to maybe all the courses I've ever done. Mm-hmm. So you learn more from patients.
Yeah, they teach you.
Yeah,
they're your teacher.
Yeah, they're good teachers. Probably the best.
And the difference between a baby being born C-section or vaginal birth.
Oh, big debate.
Why, Adele? Why? We only have a few minutes, Adele. That's going to take 2 hours. No, it's fine.
I feel like that's a whole different, a new
other podcast, Adele.
A new pod. Listen, I feel like, again, there's a lot of fear around that subject. I feel like sometimes mum feel like they failed if they had a C-section, which...
Such a disadvantage.
Sometimes, at the end of the day, I know that's, when you look at the person in front of you and their newborn, you kind of have to, let them know that.
So I'm very much about telling people there's no hierarchy in birth.
Yeah.
One is not better than the other. One doesn't give you a golden star more than the other. Sometimes I'm the one, you know what you need? you need this epidural, you need to go straight for the C. Let's schedule it in. Or you need to, let's go unmedicated for whatever stories they have, because everybody has a different story.
Everybody.
And bodies have limitations.
Yeah.
If bodies have a limitation, that's what the science is there for.
Yeah.
And let's find the magic in that, the joy, the celebration. It's not one way or the other.
Yeah.
Yes, babies are born differently vaginally. They have certain benefits, and it's different for C-section babies. But at the end, everything is fixable.
Yeah.
Even babies that get taken away for 26 days for whatever reason, that's fixable. We touch, we love, we bond, and we learn to stretch, and we learn to connect, and everything's fixable. Like nobody's ever broken forever.
Yeah.
And then I think that should be the message.
Yeah.
Yes, it's different for one way or the other, the passageways, but we're all the same. We're all the same.
I feel like women really tend to hear the negative stories and forget the positive stories. And I feel I sometimes have to stop them, and I have to say to them, this happened to your friend and I'm very sorry. But, this is an independent journey that you're facing. And we can't help it to compare a journey compared to the other one. I've got patients of mine, they're completely thriving throughout all 3 pregnancies they had. And then I have patients that thrived for the first one and the second one was a bit harder. But there's no better than other. The support system is going to be different. And it's not because you've heard the worst that this is you necessarily. So it's good to acknowledge the negative story, but it's also good to really acknowledge the positive story and make sure that the women are embracing in their own journey instead of always expecting the worst outcome, because at the end of the day, we can't control necessarily the outcome, the birth, the labor. I think a lot of people don't understand that, there is a percentage of the end goal we can't control. We don't know what's going to happen in labor. We don't know.
It's magic.
It's all magic. And that's what people don't know.
That's the name of the podcast. It's all magic.
Yeah, I said it's part of magic, a part of faith, a part of everything, but people
But the
don't
fact that
know.
we're here is magic.
Exactly.
And Adele has heard me speak a million times, possibly at this point.
Exactly.
And you've gotten really intimate with my words. Really, I just published a book last month. It goes really into deep conversations about me and what women feel and what they learn through mothering and becoming a mother.
Yeah.
And it's not the physical stuff. It's more spiritual. It's shadow work. It's the triggers.
Yeah.
Okay. But more specifically, doesn't matter if it's C-section, and we've had this conversation in a previous podcast. If it's a C-section, if it's a bed, if it's water birth, because I'm a big water birth educator. But the most important thing to the core is, how did the woman feel? How does she feel?
Yeah.
That's the only thing that matters. Emotionally, yes, physically, but more, how does she feel? Does she feel supported? Does she feel loved? Does she feel safe? And that's it.
Yeah.
So nothing else matters.
Yeah.
Everything else is details. Everything else is, okay, my neck is a little tense, crooked, we'll go see someone. Right? My baby came out a little funny looking. It's fine. There's people you can go see for that.
Not me, clearly not, but
Clearly not me.
clearly not me.
Or maybe I've seen a few people. Who knows? Maybe that's why I look so cute. No, but that's the idea.
Yeah.
It's, how does she feel? And my goal, and I hope everybody's goal, is to let them know that it's okay to feel, and it's okay for you to feel good.
I think people sometimes have a hard time understanding that they don't like not being in control, and they don't like not knowing. Sometimes they sit there, they take off their sheet of paper, it's like, yeah, but if this happened, if that happens, if this.
I've had women have birth plans that are binders. Binders, if this, if that, if this. And then when they're in it, they're like, but that's not in the binder. I'm like, I know. That's what I'm trying to tell you. There is no blueprint. There is no guide. There is a guide that I just published, but it's a different kind of guide. But it's I don't know. It's all amazing.
It is very amazing. And at the end of the day, I think what women do during this journey is absolutely phenomenal. And again, knowledge is power, and you can prepare for birth and you can prepare for labor as much as you can. But I always emphasize on that part where it's going to be out of your control. And it's very important to say it out loud. There is going to be a portion of of this chapter is going to be out of your control. So you have to.
And when the babies are born,
Yeah.
they're going to be
Same.
Same.
Yeah.
That's my guideline. It's fine. It's fine.
It's all
Why?
right.
Because to get to a place of it's fine, that means surrendering to what will be. It's about building that confidence, and the only way you build the confidence is with the education, like you were saying.
Addressing their particular fear, because every woman's fear are going to be very different. Again, depending on the support system, depending if they experienced loss or miscarriages, depending on social background, but also cultures. I can see it. The different countries I've worked, people's fear are very different from cultures. So addressing what's right for that person and their concern is the best way to move forward. So,
I mean, you work with a lot of pain. Right?
Yeah.
People in pain.
Yeah.
What is your feelings about pain and fear, and how does it relate?
Highly correlated. Yeah.
So would you say somebody who's more in pain, they are more fearful? Or
I wouldn't put it that way, but I know for example, like some people that are in pain and the pain is not addressed, they would feel a lot of anxiety, depression, loneliness. That's we know that. Sometimes some physical pains, you need to know when you have the person in front of you, you need to really understand, okay, I've got low back pain, like that just happened 2 minutes. The person's going to be straightforward. But it's the moment where the patient is going to start telling you something a bit extra, a bit more private, a bit more, and then they're going to sit there, and then they're going to stand up, and then they're going to pick up something from the floor, and then they're going to wiggle, and then you're like, oh, that's not low back pain, that's just something going on. They want some answers. And sometimes I spend my whole session not even examining them, but just listening and answering their question and educating them. And they go out with the biggest smile on their face. And I think that's where, sometimes you need to see. You need to acknowledge it, you need to listen, and you need to obviously help them and support them. But pain is perceived very differently to a lot of people. So what is the pain caused by? Is it, oh, I went deadlifting? Oh, I woke up with pain. I have a lot of pain here. Oh, but yesterday I had a huge fight with my husband. I can't breathe. I didn't sleep all night. What happened? I'm going to get fired. Like, you kind of see how, you can respond to the person.
So how would you respond to that very famous saying that the body keeps score?
Yeah, it does. In certain ways.
Okay.
Yeah. In certain ways.
And how do you see that in pregnant women? What do you see that in pregnant women?
Again, it really depends. Like the range of symptoms in pregnancy, there's a list of symptoms. The symptoms, again, as I mentioned before, it affects all 7 systems of our body. Our breast, our breathing, our rib cage, our uterus, our bladder. So it affects all systems, the swelling in your legs, the varicose vein, the leaking, the prolapse. It affects our body in so many different ways. And a lot of it, again, is common, but we can do something about it and supporting them through there. And obviously, again, during pregnancy, I'm a big advocate of acknowledging mental health, and their situations also is very important. So, from there, you can tailor the treatment. And if it's something that I can't do myself and I know they need a bit more support and they need to be maybe addressed a bit more about fear or mental health, then, refer on and work with somebody that can help in that aspect a little bit more profoundly. Because at the end of the day, we do have a limited time with our patients and we can't do everything. That's the reality. So I try and do my side of things, and if I know it's coming from somewhere a little bit more deeper, then I know that I can get additional support.
And how do you feel, what is the role that the patient, the pregnant mummy that comes to you, or postpartum mummy that comes to you, what is her role in this process of healing?
I feel like patient compliance sometimes is, when someone is not getting better, obviously I always think what I've done wrong personally. In my head, it's like, what am I missing here? And then there is a huge part of responsibility of the patient. And, if they don't want to listen, if they don't want to do the work, if they don't want to do the rehabilitation, then I can't feel accountable for all of it. You have to be also very accountable for your own healing, for your own nutrition, for your own physical activity, minutes per week. I can't do that for them. I can help them do it. I can help them maybe prescribe specific exercise that's going to be adequate for them, specific things to treat their lower back, their rib cage, their breathing pattern, guide them through it, but I can't do it for them. So I do feel like there's a huge responsibility on the patient's side to also nourish their body, self-love their body, and take the education that we give them and kind of tick the boxes that what's needed to be done to get better. If they don't get better, of course I think, okay, what else can I do? But if my patient, people are honest, they're like, Juliette, I haven't done nothing of the stretches that you've gave me. How are you feeling? Better, but still pain. Okay, let's do the stretches. So you can't do everything as a practitioner. And so you have to sort of, sometimes I wish sometimes, I could be, like I say, a magician and, better.
Yeah.
But you do have to be, as a patient, accountable for also your healing process and your healing journey.
And I believe that as soon as somebody takes responsibility, that's the only time that we can actually heal.
Yeah.
Without the responsibility, I don't think we're capable of healing.
Yeah.
So
I think with pregnancy and postpartum, I think there's also the support system behind it can be huge because, postnatally they are taking care of somebody else than themselves.
Yeah.
And a lot of people don't realize how hard it is until they actually experience it. And,
but also taking the responsibility to reach out and find help, right?
Yeah.
But it's not always there.
No, it's not always there.
And that's
it's not always there. Sometimes you can feel very lonely, I think, in these moments.
If the body could speak without being interrupted, what do you think it would say?
Oh, that's for you.
No. I think that's 100% for you. Are you talking from like a physical point of view, or this is so much? My body is talking to me all the time. I don't know. What do you think?
I mean, you
listen to me, take care of me, love it the way it is.
Yeah. Listen
it's
to your
yours.
gut.
It's giving you so much gifts.
Yeah.
For me, example, I've birthed 6 children with this body.
Yeah.
I was a model and stuff. I've had a stroke. I've had issues. I was in a wheelchair for a while, but I'm here. I'm strong. And people see me, they're like, oh. But I'm like, I love my body. It's given me so much.
Yeah.
And yet I'm standing here. And so I get to love it every single day. And that's why on the way, I'm like, do you have my bushy water ready for me? Because I know my bushy water. Because I need water straight from the mineral. Because I feel it makes my body, it thanks me when I give it something better.
Yeah. 100%.
And that's really just what it is. It's not because I'm like, oh, I need ducks. No. It's because I'm trying to thank my body. If it feels better, that's what I want to do.
Yeah.
That makes sense?
Yeah. Oh, definitely.
That's why I called her. She goes, you have bushy water for me? She's like, no. I'm like, oh, Adele.
Yeah, I think listening to your body and your gut instinct, but also helping your body. And I think, there's many things you can do. Like physical activity is one of the major one that is still often very not something people are willing to do, but we know the huge benefit it has physically, mentally. Still too much fear around physical activity, but that's where we can do a lot of things.
I've got a question for you regarding activity, because one thing that I struggle with is doing too much versus too little. I mean, I don't think, and from a professional point of view, that we need to do that much. Like,
Yeah.
because we live in a society, you need your 10,000 steps and you need to go to the gym every day and, that type of thing. What is your perspective on that?
I think, we hear you have to move, but don't overdo it. You have to eat, but don't gain too much weight. So it can be very confusing for a lot of people. It depends again on the person and the goals. If you want to enter a competition and you have to do this kind of weight, then you have to work towards achieving that goal. If you're a regular person that just wants to, stay healthy, feel good, get the benefit of the good hormones out of training, you have to do what you can do for yourself, but also something that you enjoy. Some of my patients said, Juliette, I hate Pilates. No problem. What do you like? I love yoga. Perfect. Is it okay if I do yoga twice a week? Yes, please. Go and do yoga twice a week. Yes, we have guidelines, 150 minutes, moderate to severe, like high intensity activity. Yeah, we have these guidelines. These guidelines are not adequate for every single person, especially in pregnancy. Sometimes, we have to work with what we can work. You need also a doctor's clearance. So, if there's a huge contraindication from the doctor for physical activity, that's also something different. But everybody with physical activity is going to be different. And for me, my biggest recommendation is like, what do you want to do? What do you feel like doing? Well, I'm 12 weeks pregnant and I've been deadlifting and lifting all my life, but I'm not sure if I should do it now. And I look at them and it's like, why not? Oh, because what? If you've used to physical activity, there is no reason why you can't continue during pregnancy. Now, if there is, again, something that is a clear no, then it's a clear no. But there is no reason why you can't enjoy what you've always done throughout your life during your pregnancy and then postnatally. Of course, there's going to be some guidance. Of course, you're not going to lift the same weight you've been lifting, all throughout pregnancy. There's days it's going to feel better than others. But why should you stop? There's no reason to stop. Now, I'm not saying during pregnancy go and start doing something completely different that you've never done before. And yes, there is sports you need to avoid during pregnancy, like horse riding, high risk of fall, scuba diving. There's things that we don't recommend to do. But there is no reason why you can't carry on. And actually, the mum they usually look at me with like glitter in their eyes. Oh my God, thank you so much. Because it's part of their identity. And then suddenly they're pregnant. And so they have to lose that identity. And that's where there's a lot of misinformation around that. And then when it comes to general, just for your general well-being, if you don't like lifting, or if you don't like Pilates, or if you don't like yoga, then do something you actually enjoy, because at the end of the day, movement is movement. And people think, oh, I've done this, I lost this much calories, no. Oh my God, my sleep was off last night. I think it gets really overwhelming, and there's some people that are very regiment in their regime and it works for them, but that regime won't work for someone else. But then this people identify to that people, and then this people ending doing nothing because they can't identify themselves to the same person. So when it comes to physical activity, I work with my patient as much as I can to do something that I know they can stick to, and that will help, obviously, if they have a specific condition, will help them at this time. But also my goal is then, right, your back pain now is so much better. I want you to carry on. And then usually I've done a good job if I manage to change their thinking around physical activity. For example, I have a wonderful example recently, but I have this beautiful mum, first pregnancy. She never trained. She hates sports whatsoever. She's 32. She never done anything. She went to boarding school in the UK. She never played hockey or netball or nothing. She never done anything. And throughout her pregnancy, I was like, we're going to have to talk about this, because you've got back pain, you've got low back pain, you're super stiff, your posture's not great. How can we work? She trains 5 times a week. She's 3 months postnatal and she loves it.
Wonderful.
So
Success story.
that's where, for me, that's a success. It's not how much you do, it's what feels right to you, but do it.
Yeah.
And that's
But then
the
also
difference.
when it doesn't feel right, just pause.
To know
And
what
that's what we
to
say,
get.
just listen to your body. You're working out in the moment you, and good doctors will tell you the moment you feel out of breath and you just don't feel good, you pause.
Yeah, you pause.
You pause. That's it. Just listen to your body.
Yeah, if it doesn't feel right, it doesn't feel right. But again, I do emphasize on the fact that physical activity has a huge amount of benefit that can't be overlooked through time. We know it's good for joint, for muscle strength, for depression, for anxiety. It's so important. And more we need to push people towards it. We can't just be sitting there doing nothing. It's not possible. We're not designed for that.
Yeah, and you were talking specifically for pregnant women. We know prepares them for birth.
Yeah.
I might forget the books.
Mm.
Forget all this stuff. We know just being active
Yeah.
will be 90% of the way there.
Yeah.
That's it. Just remain active, move around. It'll help with the baby's positioning. It'll help with the tension in the body. It'll help with the muscle tension. It'll help you release your baby. And it's the women that are constantly not being active that we find have more issues.
Yeah. Reduces the risk of gestational diabetes, reduces blood pressure, we know.
But specifically at the birth, because everybody's so focused at the birth.
Yeah.
Well, it's not the conditions, it's what did you do your entire pregnancy?
Yeah. How did
All
you
of it's
prepare
gonna help.
for it?
How did you prepare for it? Were you moving around? They're like, Carrie, how did you have 6 amazing vaginal births? I had 5 toddlers running around. I was running all day. I was cleaning all day. I didn't have maids. I didn't have nannies. I was doing everything. I was always doing something. My body was constantly moving and stretching and doing things.
Yeah.
And I think that's really what helped.
Yeah. And then sometimes, even as you mentioned, like once you have children, and you're constantly lifting and constantly carrying, it puts a huge amount of strain, and that's a reality because they're constantly doing it. So you have to condition your body to lifting, packing, changing, doing this. So I even recommend, sometimes I've got cases where people are like, oh, I'm thinking of getting pregnant. Of course, you can't really decide when you're getting pregnant, but, I'm thinking of putting all my chances in it. I highly recommend my mums, and I always ask them, what do you eat? What do you do? What do you do to move? And I highly recommend, even before thinking of being pregnant, to actually get themselves conditioned to pregnancy, because it's a huge amount of strain on the body and repetitive strain. So the more you're going to be, I'm talking physically, conditioned to it, the better outcome. And we see it. The outcome is better. The deliveries are better. Everything's better. So it's a good thing.
For all the mummies out there, we have to keep exercising.
Keep going. Yeah. At your own pace, but keep going.
Or moving.
Yeah.
Dancing.
Yeah, exactly.
Sex.
Yeah.
That's funny you had to say. Because that's usually the first thing off the table. I'm like, oh, why?
Yeah.
She's like, that's another podcast.
Yeah.
She's like, not this podcast.
Different topic.
Definitely another.
Yeah.
Juliette, if you can change one thing to support pregnant women, what would you change?
Wait, can you add the magic wand, please? I love that question. Ask her.
If you have a magic wand, you can change one thing in supporting pregnant women, what would that be?
I think today would definitely, my focus would be on helping women in a workplace environment, because I feel like so mums that are focused on their career and do want to build a family. I think today, my answer would have been different a couple of years ago. I think today what I see that what we struggle with, and which is something maybe I would try and change and help more, is the workplace environment. Because when we think about it, obviously the external support is huge, but when you have mums that are full-time career mums, and they have a full-time job, and they spend most of the time in the workplace environment, and they're pregnant, it's a hustle. It's a huge hustle. So there's, and we see it, I have loads of working mum, lawyers, whatever, and they're like, Juliette, I can't bring my ball at work. I'm like, why not? I can't sit on my pregnancy ball at work. It's like, well, you're going to have to do something. Or, I can't stand up because I can't go and pee in the middle of the meeting. There's not just, there's just this, it's almost they're ashamed to be pregnant because they know that it will impact where they're at in their careers. And if there's one thing I could do and support more, I think we need to look at this more profoundly, because it's becoming more and more of an issue. And not there's things being done, but we're just simply not quite there. And also, another concern I have a lot is I can't afford not to work. And that's another thing. Whether we're in Dubai or not, at the end of the day, we need to work more on that. So that will be my thing for the moment.
So you're saying make it less of a man's world
It's
and a little bit more woman friendly.
I feel
in
like
general.
there should be working. I think as a woman, you should be able to work into your workplace and not feel ashamed of being pregnant. Haven't told my boss yet. Well, there's going to be an issue here. Yeah, they don't need to know. Like, okay. So it needs to be, we need to find a solution to have a bit more openness about it in a workplace environment without, again, as a physical activity or career-wise, not losing their identity completely. Because for a lot of women nowadays, it leads to isolation, depression, anxiety, and stress, not to be able to do what they like to do, but also have a family. So, yeah, that would be my next thing.
That's an easy thing done.
One day.
I think that's why we have these conversations, right? Is to bring awareness and to support.
Yeah.
And that's also going to bring out to our next podcast, where we're going to talk about returning back to work, which I'm very excited about.
Oh yes, of course. Yes.
So, but thank you so much for being
Thank
here,
you, Adele.
Juliette.
Thank you.
Thank you, Caridad, once again for being here. And then thank you for keeping all the mummies healthy.
Yes, we try.
And
looking fabulous while doing it.
Yeah, trying. Going to work.